Hey guys, welcome back. If you're new here, I'm Chantal Purcell, and I am a breast cancer survivor and in the midst of my reconstruction journey. So my personal goal is to reach my hand back to the girls that are coming behind me and share things that I've gathered along the way. To get right to it, today's video is going to be my personal tips and tricks and sort of like my mastectomy must-have list. So I actually had a bilateral mastectomy, but I think that the things on my list would be applicable for either a unilateral or bilateral. Number one on my list, a recliner. Okay, so after surgery, they really like you to sleep on your back. Now, I didn't have immediate reconstruction, but I think it's kind of the same whether you do or don't have reconstruction, that they prefer you sleeping on your back and preferably at a little bit of an elevation. I can't imagine having even tried to sleep, like I'm a side sleeper, but I can't imagine trying to sleep on my side right after surgery. So I did bring a recliner into my bedroom. I didn't want to feel like I was going to bed in the living room. So I brought a recliner into our bedroom, my blanket, a small pillow, because you don't necessarily need a full-size pillow, just whatever's comfortable. And so I will say that I slept like a log after surgery in my recliner, and it took me months to actually get out of it because I really kind of like it. Like I said, I'm going through my reconstruction right now. I'm back in the recliner for like the third time, and I'm not tired of it. Now, one little tip I'm going to tell you is that, there are power recliners. If you can get one of those, if you have one of those, afford one of those, good for you. I couldn't. So what I did is I, bought an old style with the little arm thingy on the side. Now, you can't use your arms like that after mastectomy surgery. Kind of think about T-Rex. You might have seen this described somewhere in some of the blogs or online as T-Rex arms. That means kind of keeping your elbows tucked at your waist. And so this is sort of your range of motion initially after surgery. So with your little T-Rex arms, you're not going to be reaching for that louver or lever to recline the chair. So what I would recommend is what I personally did is I actually kept the chair in a reclined position. But before my surgery, I practiced getting in and out of that chair without using my arms. And I literally would go like this, and it's all abs and all legs. So you get a little bit of a workout, but start practicing before your surgery so that after your surgery, you can kind of figure out what way works best for you to kind of get in and out of the chair. All right, so I'm gonna get on to number 2 on my list, and I have a cheat sheet only because you guys, I still have chemo brain. I can't remember a damn thing, so I have to write everything down. All right, number 2 is a front close compression bra. They don't really talk too much about this necessarily. It depends on your doctor. Every doctor's different. And but they might recommend a compression bra, front close, and it's basically, like the bra hooks on the back. It's a whole line of them in the front, so maybe about 5 or 6 hooks or so, and usually has just like a bra strap in the back, would have multiple settings, like maybe 3 settings for loose, medium, and a little more snug. Now, with this in mind, know that some insurance carriers actually cover certain special bras for breast cancer patients. So check with your insurance. For instance, when I had my mastectomy surgery, I actually had one insurance provider, and they allowed up to 3 garments per year. They also allowed, this is like a side note, they also allowed for 1 pair of prosthetics per year. Those prosthetics are about $500, $400 to $500 a piece, and I had both. So check with your insurance for bras, compression bras, as well as prosthetics. So prosthetics, like a little bonus for this edition. Number 3 on my list, pillows. So I actually had a friend of mine gifted me sort of 2 rectangular pillows. I've seen different sizes and shapes, like heart shape. Not necessarily like a right or wrong shape. What you're gonna want these pillows for is to elevate your arms slightly after surgery. I can't really, it's hard to explain everything. I'm gonna do my best, you guys, but when you're putting your arms down after a mastectomy, that kind of just sort of puts a little added weight, I guess, on your arms. So to slightly lift and elevate those arms takes that extra weight off, and you'll find it more comfortable both for sitting and sleeping. Now, when you go for your doctor's follow-up visit, you're going to want some type of pillow, and maybe just a normal bed-size pillow. I mean, my mouth won't keep up with my brain today. Bed-size pillow for the front chest area. You could use your little underarm pillows if they're large enough, but you could also just grab that pillow off your bed and put it on your chest underneath the seat belt, because you're going to want some extra protection. Number 4 on my list, a zip front or button front top, hoodie, blouse, whatever. You're going to want to not have anything that goes over your head, because you're not, T-Rex arms don't go up that high. So you need to get something that you can actually put on without going over your head. So my personal favorite has been the zipper, you guys. Like, buttons just kind of take too long. Zipper is like one and done. And I have discovered, having surgeries at different times of the year, of course we all know the zippered hoodie, that's perfect, but in the summer months, and I live in a warm climate, so summer months, there's actually thin weight. You can find them online. I actually have found them at Ross, Marshalls, TJ Maxx, my favorite places to shop, and but thin little zippered hoodies. So they're not all like thick sweatshirt material. They do actually make them in a thinner garment. So this is sort of a year-round solution, no matter what time of year your surgery is happening. All right, a drain belt, and this is something kind of interesting. So you're going to have drains. You've probably seen and read a little about that. There's no fun way to explain those, except for they're a bit of a nuisance, somewhat uncomfortable. You'll be happy to get them out, but the reality is we have to have them for, sometimes like a week to 10 days, maybe 3 weeks. So everyone's everyone is different. Every drain is different. They might remove one at 7 days, and they might leave the other one for 3 weeks. So, it really depends. Also, the amount of drains that you'll have will vary. You might have 1, you might have 4. I've had sort of in between that as well. I think the first time was 4, the second time was 3. So I was super excited the second time, and I was like, oh my God, I only have 3. So anyway, drains are drains. We have to deal with them. So one of the good ways that I found to deal with it is by using a belt. The little drain bulbs themselves actually have a built-in little tab where you can suspend it or hang it from a belt. Any belt would do, but there is a mastectomy belt. You can just Google it online. I'll actually put a link in the comment section or in the description section of the video for the one that I use, just an easy little clasp. So the benefit is that it can just kind of keep them snugly around your waist. You can see them, because you'll also see different people have different opinions, right? Whatever works best for you. My personal preference, you'll see different options where it has pockets. I personally didn't like the pocket because it created an extra step for like 3 or 4 drains. May not sound like much, but if you're feeling a little puny and you got to deal with these drains, anything to make it a little easier, right? So I personally preferred the belt, because all I had to do was lift my little zippered hoodie and I could see the level of fluid that was in the bulb easily. If it's in a pocket, then you have to kind of lift your clothes, get around the little pocket and take it out of the pocket, look at the level, put it back in the pocket and back to the, so it's just a little more work to get them out of the pocket. And I say this because some of the pockets are sort of like inside your clothes and a little awkward to get to anyway. Again, I kind of just prefer the basic little mastectomy belt. It holds as many drains as you have, as many drains as you need. So all of your drains are actually suspended from the same garment. Now, any belt will work for this, you guys, but this particular belt just has that little simple, little easy clasp. So that's definitely easier than trying to like go through like button, whatever, the little holes and all that stuff like a normal belt. So whenever you are ready to shower, different doctors will have different guidelines on how long they'd like for you not to shower, to avoid getting the incision areas wet, to avoid getting like where the drains come out, to avoid getting that area wet. ultimately just to avoid getting an infection anywhere near your surgical sites or open areas. So they'll tell you what their recommendation is for how long to avoid the shower. Once you're ready to take a shower, if you still have drains, one thing that I actually found super helpful is I happen to have some elastic stretchy bands. Any kind of little stretchy band or piece of elastic will work. So this was a little bit more of like a rubbery elastic that could get wet, and I would just run it, I would actually wrap it around my waist while I have the mastectomy belt on and start running it through the little tabs on the bulbs, and then I could just pull the other mastectomy belt, pull it out of the little tabs. You don't want to shower in your mastectomy belt because you don't want it to get wet. It's cloth. This particular one is made of cloth, so you don't want to get it wet, so that's why I sort of recommend the rubbery one. All right, so moving on to number 6. Since you're not showering necessarily for, like initially, bathing cloths is something that you should get like ahead of time. And I'm just, again, just trying to get you a little prepared for your mastectomy. Bathing cloths are better quality than baby wipes. They have them usually in like the medical section, whether it be like Target or Walmart. Sometimes you can actually get some from the hospital themselves, and those are actually the fancy dancy ones, the like thicker cloth and bigger square. But honestly, I actually got a package from Walmart, which was super affordable, and I gotta tell you, like 7 months later, 6 months later, they're still wet. I actually still have some left and they're still wet. So those are a really good option. Quite honestly, when you're not able to shower for the first few days, it, as my mom says, hit the high spots, so you can kind of like really kind of clean yourself. Now, again, you're gonna have T-Rex arms, so you might need a little bit of help, but you can reach your underarms. And ladies, one of my personal questions was, can you reach your hoochie coo? Yes, you can. So with your little elbows tucked in, you can still reach your private parts. So you'll be able to do that yourself. So I just figured that's a good little side note to know, because, it's like we lose a lot of our modesty, but there are some things that we just should be able to keep private. And that's one of them. So anyway, yes, you can do that yourself. With using your little bathing wipes, you can, keep yourself clean throughout the day, like every time you need to go to the restroom. And but I do recommend like having sort of like bath time in the morning. It makes you feel good once you're kind of ready, maybe a few days after surgery, but when you're ready, bath time really kind of feels nice. And if you have someone there to help you, even better. They can maybe reach a little further down your arm, down your legs, and if you're really nice to them, you can maybe ask them to put like a little nice smelling lotion on for an extra little touch. So it all feels good. We deserve some pampering. I absolutely think we deserve some pampering, and usually our loved ones are happy to do that for us. Okay, moving on. Number 7, loose fitting, easy to pull up pants. So as much as I love yoga pants, like all of us, right? This is not where we want yoga pants, because those just are a little snug and a little more effort to get on and off. So I went with like just sort of like a real loose waist. A lot of them had like a drawstring with a super light elastic band, kind of like a little thin jogger pant, or if it's winter, a sweat pant, but a loose fitting, so that they're just easy to get on and off. And I'll be really honest with you, I gave up on panties after like surgery number 1. I'm like, this is just a whole wasted stuff. So it probably sounds like I'm lazy, but I don't know, you guys, after you're having like these major surgeries and stuff, like it's just sometimes you want to cut off some of the extra work, I'm all about cutting out the extra work. So you can skip the panties, no one's going to know but you. And I would recommend maybe 2 or 3 pair, just so you've got some, while they're being laundered, you've always got a fresh pair to put on when you have your little bath time in the morning. That feels so nice. Okay, what else? Okay, this is my last one. This is my holy grail. Wash your hair and shave your body before you go in for surgery. So you'll be starting off with clean, fresh hair and no hair anywhere else. Now, if you're lucky, you've had chemo and maybe you don't even have to shave. That's how it was for me. Maybe you don't even have to wash your hair if you've had chemo. There are some upsides, girls, see? But if you haven't been lucky enough to have chemo, then you're gonna need to shampoo your hair and shave your whole body. So I've heard of different girls doing like a ponytail, just keeping it kind of easy. And actually recently one of my breasties went and had her hair braided before her surgery, and I thought that was the cutest idea. So whatever you decide to do, definitely start off with clean hair and a shaved body. All right, so those are my tips and tricks and must-haves for mastectomy. If you have any questions, I'm always here. Just send a little message in the comments below, and I'm happy to answer. And you know, part of my purpose, you guys, now is just sharing everything that I've been through. What I've learned through this entire process is that fear comes from what we're not sure of, you know, from the unknown. And going into each step of our journey, if we feel like we have some information, sort of like what to expect and how to deal with, you know, various situations, I think it really kind of helps us to fear less and to worry less and to feel prepared that we're doing the things that we need to do. And anyway, so when I kind of compiled this list by common questions that I get from people. So these are a lot of my common questions. So hopefully you like these answers. If you have also been through this journey and you've got some personal tips, tricks, advice that you or must-haves that you'd like to share with all of us girls, please do so in the comment section below. You will get through this. You are a badass warrior and you're not alone. Know that you're not alone. And there's an entire community of women that have gone before you, and just know that I am reaching out my hand and my heart, and I'm pouring so much love over you right now. Oh, it just makes me emotional. But I just want you to know that you're going to be okay. And it's just a little hiccup in this whole big picture of life. And so much beauty comes from this ugly disease. So until next time, my friends, I usually say get out there and live your best life, but if you're not out there and you're kind of a little more in, that's okay. You can still just soak in all of the love, the prayers, the light, the energy, the well wishes of your friends and loved ones as those things come in, and let that fill you, let that fill your heart, and let that be sort of like helping you live your best life through this part of your journey. And much love to you guys. We'll see you next time.